Good morning. My name is Virginia. I'm going to be taking care of you today. I'm doing your physical assessment. Thank you for coming in. Can you give me your name and date of birth?
Laura Martinez, 12/14/69.
Perfect, Laura. Nice. I'm glad you came in today. I'm going to go ahead and do a complete physical assessment on you from your head to pretty much your head, nose, and throat. If you have any questions, any discomfort, please let me know and we'll go ahead and stop, okay?
Okay.
Perfect. So what I'm going to do now is I'm inspecting your skin. I'm looking at the general appearance. I'm looking at the color. I'm looking to see if you have any type of bruising, any type of birthmarks, any skin conditions that I notice. I don't see anything unusual. Your color looks normal. For your ethnicity, warm, dry, seems like it's intact. I'm gonna go ahead and inspect for your turgor. You don't show any signs of tenting. Like I said, the color looks nice and pink, dry. I'll be checking your capillary refill. Looks really well. Noted to be less than 2 seconds on each finger, both hands. Now I'm going to go ahead and check your head. I'm looking for symmetry, no signs of any masses. I'm checking on the texture of your hair. It's evenly distributed. You look like you take care of yourself. It's nice and clean. It's no obvious signs of scalp lesions that I can see. No signs of infestations. I am now inspecting and palpating your nails, like I said. Capillary refill, perfect, in each finger. Now, like I said, the head is symmetrical. Overall shape is normal. No signs of any trauma. I palpated the head and scalp. No tenderness, no pain anywhere touching on your head.
No.
No tenderness or abnormalities noted. Now I'm going to go ahead and what I'm going to do is I'm going to check your sinuses. I'm going to go ahead and check your frontal sinuses. If you have any type of pain, please let me know. Your maxillary sinuses, perfect. No signs of tenderness, no complaints of pain. Now what I'm going to do is palpate your temporomandible joint. So what I'm going to do is I'm going to ask you to open and close your mouth. Any pain or discomfort there?
No.
Great. No crepitus, no tenderness, no limitations noted. Now what I'm going to do is I'm going to inspect your temporal arteries. Any pain here?
No.
No tenderness?
No.
No without thickening. What I'm going to do now is ask you to turn your head to the side. I'm checking her jugular vein distension. Nothing noted on that side. Go ahead and lean your head that way. Actually, nothing noted on that side. So now what I'm going to do is I'm going to palpate your neck. I'm going to come down. And I notice that your trachea is midline. Perfect. That's exactly what we need. And now I'm palpating your thyroid glands. No signs of enlargement, no tenderness. I don't feel any nodules. Tenderness not noted. Perfect. Now what I'm going to do is I'm going to palpate your lymph nodes. Okay. I'm going to start off with your preocular, auricular, your post-auricular, your submandible, the submental, the supraclavicular, the infraclavicular, your anterior cervical, and your posterior cervical. No nodes are noted. They're nice and mobile, non-tender, correct? No pain with any of that?
Nope.
perfect. Now I'm gonna go ahead and check on your eyes. Your eyebrows are both even. They seem like they're both symmetrical. Your orbit area is nice. Any pain, any discomfort here?
No.
Your eyelashes seem nice and even. Your glands look nice. Eyelids, no showing signs of any edema, no lesions. Eyelashes are evenly distributed. No redness or swelling in your glands. Perfect. Now what I'm going to do is I'm going to gently put some pressure in your orbital area. No pain or discomfort there.
No.
No swelling, no tenderness. Perfect. Now I'm looking at your eyes. Your sclera is nice and white. Your conjunctiva is nice and pink. Nice and moist. And no signs of any type of issues going on with your eye. Looks perfect. No lesions noted. Now I'm going to go ahead and assess your pupillary response, pupils. Give me 1 second. I'm going to go ahead and use my light. Pupils look even and reactive. Like I said, sclera is white. Nice and pink conjunctiva. Moist. Perfect. Those are great. I would like to, normally I would examine your red reflex, but we're going to go ahead and defer your fundoscope at the time. Now I'm checking your ears. Ears look symmetrical. They're lined. They're nice and soft. No signs of lesions. They're aligned. No redness. No drainage. I'm palpating the auricles and the tragus. No tenderness. No tenderness noted. As far as your hearing, I'm assessing while we're talking. You're conversating, so I know that you are hearing okay. I would normally check your tympanic membranes, but we are going to defer that assessment for this class.
Okay.
Now I'm checking for your nose. Nose looks nice, symmetrical, alignment, no signs of deformities. The nose is midline. I'm going to go ahead and check your nares again. Look nice and pink. Nasal mucosas are pink. Moist. The septum is midline. Everything looks nice and pink. No drainage. No edema. Looks perfect. Now I'm inspecting your mouth and your throat. Your lips are nice and pink. They look moist. No signs of lesions. Now I'm going to go ahead and open up your mouth for me, please. Okay, teeth look nice. Gums are nice and pink. Stick your tongue out, please. Tongue is midline. Open one more time. Perfect. Your tongue is midline with smooth movement. No lesions noted. The floor of her mouth is nice and no signs of swelling. No masses noted. And we'll go ahead and continue on. Now, like I said, I took a look at your skin. It's nice and moist. Temperature's nice and warm. Moisture's nice and dry. Texture looks great. No signs of edema. No turgor noted. No bruising, no scars, no lesions. Skin is intact. Now I'm going to begin with your musculoskeletal system, okay? So what I'm going to do is I'm inspecting your joints. I don't notice anything in your joints. They look symmetrical. Alignment is no deformities, no swelling, no muscle masses. Joints appear symmetrical with no redness. Your muscle tone seems appropriate bilaterally. I'm inspecting the skin over the over your musculoskeletal system. Texture, like I said, no signs of edema, bruising, or scarring. Skin's intact. Now we're gonna go on to your range of motion. We're gonna go ahead and check on your neck. So if you could do me a favor, move your head forward and backwards. Can you move it side to side? Perfect. Okay, can you turn it like, can you roll to the right and then roll to the left? Perfect. Range of motion is smooth with no signs of pain. Perfect. Okay, for your arm, for your shoulders, do me a favor. Put your arms out to the side. And then bring them back in. Great. Go ahead and put them forward. And rotate them. Yep. Okay. Your shoulder range of motion is full bilaterally with no tenderness and no limitations. Elbows. Can you go ahead and bend and straighten? Bend and straighten. Perfect. Can you put your palms up and your palms down? Perfect. Elbow range of motion is intact bilaterally. Perfect. Go ahead and do me a favor and put your wrists out and flex them up and down, up and down. Perfect. Okay, now do me a favor, roll them to the thumb and roll them away to the little finger. Perfect. Wrist movement is smooth and full bilaterally. Fingers. Let's go ahead and do your fingers. Open up your fingers and close your hands. Spread your fingers out and put them together. Great. Finger flexion and extension and abduction are intact bilaterally. Great. Now with your hips, what you're going to do is, can you extend your hips? Can you move them? Can you put your hip up and then down? Can you do the other one? Up and then down. Perfect. Can you move them outward? Your hips. Keep your legs down and move your hips out.
My hip?
Like, yes. Go ahead and open them up like that. Yep. And then go back in. Perfect. Hip range of motion is full, bilaterally with no pain. Now, as far as your knees, can you straighten out your knee? And now bend your knee. Great. Your knee flexion and extensions are intact bilaterally. Both legs, can you do both? Perfect. Okay, let's check your ankles. Do me a favor, go ahead and point your toes down. And now pull them forward. Great. Your plantar flexion and dorsal flexion are intact bilaterally. Do me a favor, can you please stand up for a minute? Okay, if you could do me a favor and bend forward and extend backwards. Can you rotate side to side? Perfect. Can you bend over that way, laterally? And then the other way. Perfect. Great, go ahead and have a seat. Spinal movement is smooth and full with no limitations. Now we're going to go ahead and check your strengths, okay? So do me a favor and push your head forward against my hand as hard as you can. Perfect. And pull it back. Great. Your next strength is 5 out of 5. And now we're going to go through your shoulders. Do me a favor. What you're going to do next is try and raise your shoulders. Raise your shoulders. And now go back down. Shoulder strength is 5 out of 5 bilaterally. Perfect. Now what you're going to do for me is go ahead and bend this wrist, your elbow. We're going to check your strength of your elbow, okay? So do me a favor. Push down on my hand.
Push down?
It wasn't recording.
Now push up. Perfect. Let's try this arm. Push down. Okay. And now push up. Bend your elbow and push up. Yeah, great. Your elbow strength is 5 out of 5. That's great. Now do me a favor. Go ahead and squeeze my hand with both hands. Ooh, perfect. Hand is strong and equal, both bilaterally, 5 out of 5. Now you're going to do me a favor. I'm going to go ahead and put my hand on your thigh. Go ahead and try and lift it up. Perfect. Again. Perfect. Hip strength is 5 out of 5. That bilaterally on both legs. Now what you're going to do is straighten and bend your knee.
Bend them?
So what you're going to do, put them down, I'm sorry. Okay, try and lift them. Okay. And now try to go back. Perfect. Your knee strength is 5 out of 5 bilaterally also. Now I'm gonna pretend like you're pushing down on a gas pedal, okay? What you're gonna do is try and push back on my hand. Push back on my hand, perfect. Let's do the other. Push down like it's a gas pedal. Now push up against my hand. Great. Ankle strength is 5 out of 5 bilaterally. So, thank you so much, Ms. Martinez. This will conclude our exam and our assessment at the moment. Do you have any questions I can help you with?
No.
Perfect. Everything seems pretty normal. I don't see anything to be worried about. And we'll go ahead and send out a report so you can have later on, okay?
All right, thank you.
Thank you for coming. Have a good day.
Thank you, too.